So we are live now. Yes, Megan, you can start.
Start करना. अभी start करना है 5 मिनट बाद start.
Live करें. Sir, we will wait for like the Zoom link is live now, so our participants are joining. So we'll wait for 1 or 2 minutes.
Okay.
Mrigendra, you can also switch on your video. I will wait for at least 1 or 2 minutes, and then we can start the meeting.
And sir, we are live now.
Yes, sir. Screen share हो रही है?
Amrigan ji, good morning.
Yes, Mrigendra.
Good morning, sir. Sir, screen share हो रही है?
आवाज साफ नहीं आ रही.
Hello.
Hello.
सर क्या आप मुझे सुन पा रहे हैं?
Yes.
Mrigendra, your screen is visible. Now you can start the meeting.
Right, sir. Right. So good morning, doctor, and good morning, all of our seniors. And I'm our animal doctors. Thank you so much for joining us for today's webinar. Our endeavor to spread awareness about rabies, which is a fatal disease but can be avoided appropriately vaccinated. This is an initiative from Kerala to the innovation to serve our society and humankind. Doctor, our webinar topic is dosage reduction strategy in rabies management, which is role of novel vaccine. Dear doctor, rabies is a world first novel 3-dose anti-rabies vaccine with great pride. We would like to inform you that rabies has successfully completed our 1-year launch with more than 40,000 animal bite victims being vaccinated, and over 100% compliance was recorded and no case ADRs was registered. So, doctor, with this, it is my honor to introduce to our speaker today webinar, Dr. Mohit Tiwari, which is MBBS DC and working as a senior pediatrician in Lakhimpur PSC, and now self-practicing in Sitapur hospital. And now I would like to request Dr. Mohit to initiate and talk. We will have a question and answer session also.
Okay.
Doctor, this is your turn.
Okay. Thank you, Mrigan ji. A very good afternoon to everyone, my respected seniors and juniors. So today's topic is very important topic about rabies. Why it is important? Because we all know that rabies is 100% fatal. So it's a very important topic, and we all know that it is 100% fatal and 100% vaccine preventable disease. So today's topic is all about rabies and its prevention, about the novel vaccine, that is rabies. So today we will discuss about rabies and what about the animal bites incidences in India, about the epidemiology, about the evolution of rabies vaccine, and what are the challenges in immunization of rabies, and about the introducing novel technology and its clinical studies, phase 2, phase 3 trials. So what is rabies disease? We all know rabies is a zoonotic disease. It is caused by rabies virus. Virus is encoded by 5 structural proteins, of which G protein is the most important, on which we focus because this G protein is isolated and stabilized and works as virus-like particle. Rabies is caused by bite of stray dogs mainly, but other animals like bat, cat, and rat, these can also infect people with rabies. Globally, if we see, there are 59,000 rabies deaths per year. In India, main cause of rabies is by bites of stray dogs. But in America, it's because of bat bite. And India, we will discuss, there are about 20,000 deaths. There are about 20,000 deaths by rabies per year, of which 91% deaths are in the rural areas because of incomplete immunization. And immunization is very important because rabies is 100% fatal, as I've told, but 100% vaccine preventable disease. Now we will discuss about the evolution of rabies vaccine. In previous era, we use vaccine, those were prepared by inoculation of dead virus or live attenuated virus in nervous tissue of animals. But nowadays, this technology is upgraded now and it's prepared by cell culture. Then what are the current challenges? Next slide, please. Current challenges are, current rabies vaccines, we all know, are the cell culture vaccines. In the previous era, we used vaccines, those were inactivated vaccines, and previous era vaccines had decreased compliance beyond the 3 injections. That's why it is very important we need such type of vaccine that has less doses. Next, please. Okay. As we all know, previously we have 4 doses or 5 doses, but now with the evolution of technology and the entrance of rabies, we have reduced the doses because non-compliance was a major issue. Non-compliance was major issue. There was decreased compliance beyond 3 injections. So we have tried to reduce the dose as much as we can. Next. So yes, this is the need. We have we want such type of vaccine which has low doses. Rabies is a novel vaccine which is prepared by virus-like particle introduction. We are not using live virus, we are not using live attenuated virus, but we are using G protein instead. And G protein works as virus-like particle. We use virus-like particle and we introduce into cell culture, and with the improved technology, with the, you can say, latest technology, we are introducing rabies. Next. And we have also trials about novel recombinant rabies G protein vaccine. Yes, we introduced previous slide, please. Yes, we introduced. We are not using native virus. Previously, we were using native virus, either dead or live attenuated. But these days, we are using only G protein, which is working like virus. That's why we are called as VLP technology. VLP, that is, stands for virus-like particle. It is not virus, but G protein works like virus-like particle, and with the replication, not whole replication of the virus, with the replication of only G protein, we formed vaccine, and that we call as VLP technology, and rabies is based on VLP technology. Next. Next, please. Next. We have clinical phases trials. These are the trials. There are so many subjects. We are comparing with the previous era vaccines and the new generation vaccine, rabies. And we have seen that on the basis of clinical 2 and clinical 3 trial, rabies is so much superior because it is only based on VLP technology. So there are less chances of side effects, less chances of adverse effects, and more zero protection rate and more immunogenicity. Next. Yes, because it's based on VLP technology, virus-like protein technology. So it's more efficacious. It's more efficacious because it's based on cell culture vaccine, and they are using only virus-like particles. So it is more safe. Incidences of adverse effects, adverse reactions are very less. That's why it's superior. Next. On the basis of this phase trials and study conclusion, we have seen that rabies was found non-inferior to the reference vaccines, and we have seen as it's based on VLP technology, so it has less adverse effects compared to the reference vaccines, and it has only 3 doses. We can say 0, 3, 7 dose within week. On the basis only 3 doses, there is you can be rabies free. So the major drawback was non-compliance. As in the reference vaccines, we have to take 4 or 5 doses or multiple doses. But with the introduction of rabies, we have only reduction of the doses. Only 3 doses are sufficient, and you can be rabies free. So it is a safe. And the major drawback, what the major drawback we had, the non-compliance. But with the introduction of this vaccine, we have decreased the chances of non-compliance. Next. And rabies has also received so many awards with the introduction of this VLP technology. I think this is sufficient for today.
Yeah. Mohit sir, thank you so much. Very good afternoon to all respected eminent doctors who have joined us for today's webinar. Let me tell you one thing, Mohit sir, the way you have taken the slides, really, it is very informative, very in a very crisp and summarized way you have completed those slides. And we have right now participation have increased more than 50 plus. We have participation for this. Who are seeing us live at present. We have my HO team also here with all with who are seeing you, and we are going through the slides. So, Mohit sir, first of all, thank you so much. Before we go for the question answer, because there are many questions I've already received. So I will read out those questions. I just like to understand from you about your experience of using Travis, if you have used, and how your patients are getting benefit from Travis, sir.
Yeah, I've used Travis on many patients, and the major drawback, as I have already told, was non-compliance. After 3rd dose that the previous reference vaccines we are using, the major drawback was the multiple doses. But we are reducing with the Travis, it's to up to 3 only. So within a week, patient can receive, and there are good compliance, and so that's okay.
Okay, sir. So one is the compliance part, and what about any feedback you have received from the animal bite victims, or like majority of cases they are dog bite victims, sir, or maybe some other bites like monkey bites or bat bite. So how frequently you see other animal bites apart from dog bite patient?
Apart from dog bite, rabies is basically a viral disease. If any animal is infected with rabies, and it bites or scratches a human body, then it may transmit virus to the human. Okay, so it works only on the virus. Basically, it works for the disease. It doesn't matter whether it's by the dog bite or it's by the monkey bite or any other animal.
Right.
Yes.
Sir. Absolutely. Absolutely. So any patient feedback, sir, you might have received that, sir, thank you so much for, because everybody is aware that, rabies का वैक्सीन तो 1 महीने का होता है, पूरा वैक्सीनेशन 1 महीने की पूरी वैक्सीनेशन प्रोसेस होती है। तो सर जब ये 1 हफ्ता बोला तो क्या बोला पेशेंट ने पहले तो? मींस कुछ ऐसा इंसिडेंट कुछ अगर आपको एक्सपीरियंस याद हो सर, which you want to share with our group?
मोस्टली जो केसेस होते हैं वो रूरल एरियाज से ज्यादा आते हैं, तो उनके तो माइंड में अभी भी फीड है कि वही महीना भर तक अभी उनको वो डोजेस लगनी होंगी। तो जब उनको बताते हैं नहीं महीना भर नहीं लगना है, सिर्फ आज लग जाएगा, 1 दिन बाद लग जाएगा, उसके बाद 4 दिन बाद और लग जाएगा, बस हफ्ते भर में तुम्हारे तीनों लग जाएंगे और इतना तुम्हारे लिए सफिशिएंट हो जाएगा। तो उनको भी अच्छा लगता है कि हाँ भाई बार बार नहीं दौड़ना पड़ेगा। दूसरी चीज, अभी तक मैंने जितने भी पेशेंट्स को 3Bs दिया हुआ है तो किसी का भी एडवर्स इफेक्ट नहीं आया, वरना कोई लेके आ जाता है कि वहां पे गिल्टी पड़ गई है या खुजली हो रही है या ऐसा कुछ आया, यहाँ पे टिंगलिंग हो रही है, बट 3Bs लगाने के बाद में ऐसा कभी एडवर्स इफेक्ट अभी तक नहीं आया किसी का भी।
ओके, थैंक यू सो मच सर। थैंक यू सर, थैंक यू फॉर योर feedback and your sharing your experiences in clinic experiences with us. So now I will just read few questions for you, sir.
Okay.
We have received one question from Amarpreet. He's Dr. Amarpreet, he's from Sitapur itself, sir. He had mentioned that if patient get 1 dose of other vaccine due to any other reason of other vaccine, same victim cannot be well for therapies 1 to 3 doses. So should we start it from again? So the question मेरे ख्याल से सर ये पूछना चाह रहे हैं कि अगर किसी एक वैक्सीन किसी और दूसरी डोज एक किसी और वैक्सीन की लगी हुई है तो क्या हम उनको थेरेपी दे सकते हैं?
बिल्कुल, बिकॉज जो पहले आपको वैक्सीन लगी हुई है वो दूसरी टेक्नोलॉजी पे बेस्ड है ना, तो जो हमारा VLP टेक्नोलॉजी का 3Bs है ना, ये बिल्कुल सेफ है, ये आप प्रॉपर्ली आराम से यूज कर सकते हैं। ऐसा नहीं है कि आपको वही वैक्सीन लगानी है।
राइट सर, राइट सर। और डॉक्टर SK गुप्ता सर हैं।
ओके,
यस सर,
क्योंकि जो पुरानी ओके
जी सर प्लीज कंटिन्यू सर।
ओके, क्योंकि जो पुरानी वैक्सीन है वो बेस्ड है, वो हमारी बॉडी के अंदर वायरस डालती है, तो हमारी बॉडी वायरस को देखती है और उसके मतलब वो वायरस से रिलेटेड बनाई गई है, तो ये भी वायरस तो नहीं है बट वायरस लाइक प्रोटीन है, तो हम सेम में भी कंटिन्यू कर सकते हैं और अलग से भी इसको फ्रेशली इंट्रोड्यूस कर सकते हैं।
राइट सर, डॉक्टर SK गुप्ता ही इज आस्किंग अबाउट व्हाट इज इट नेसेसरी टू हैव अ बूस्टर डोज आफ्टर 3 इंजेक्शन?
नॉट नेसेसरी, बिकॉज सीरो पॉजिटिविटी जब 3 डोजेस लग जाती है उसके बाद ही सीरो पॉजिटिविटी अच्छी है, तो बूस्टर का एज सच रिक्वायरमेंट नहीं, नेसेसरी नहीं है, क्योंकि हम तो 1 2 3 डोजेस में ही आपको कंप्लीट करे दे रहे हैं, बट इसके बाद में भी अगर आप लेते हैं तो बूस्टर बूस्ट योर इम्यूनिटी, बट ऑलरेडी 3 डोजेस मेक्स योर सीरो पॉजिटिविटीज एट टू दैट लेवल कि वहां तक आपको फिर आगे चांसेस नहीं है कि आगे कोई आपको फिर से रेबीज वगैरह हो सकता है।
Absolutely, yes sir. Dr. Mohammed Usman is asking what is this webinar is for. So Dr. Usman, this is a webinar we have prepared for to spread awareness for rabies, and through a novel innovation which Cadila Pharma had done in terms of rabies. It's a 3-dose vaccine. So that is the question from Dr. Usman. Apart from that, sir, doctor is asking about use of RIG immunoglobulins. In which category we can use immunoglobulins?
Okay, immunoglobulins, there are 2 types of protection. Right. One is active production and second one is passive production. Immunoglobulins provides passive type of protection. This is passive immunization, you can say, passive protection to the body. मतलब डायरेक्टली इम्यूनोग्लोबुलिन हमारी बॉडी में आ जा रही है, ऐसा नहीं कि हमने एंटीजन इंट्रोड्यूस किया फिर बॉडी हमारी उसके अगेंस्ट एंटीबॉडीज बनाएगी। ऐसा सीवियर केसेस, इन द केसेस ऑफ सीवियर बाइट वी यूज बोथ वैक्सीन्स एज वेल एज इम्यूनोग्लोबुलिन्स। इम्यूनोग्लोबुलिन्स आपका तुरंत सीरो पॉजिटिविटी कर देती हैं, जिससे कि चांसेस कम हो जाते हैं, और हमें प्रोटेक्शन करना बहुत जरूरी है क्योंकि रेबीज 100% फैटल होती है, इसलिए एट ए टाइम जहाँ पे बहुत ज्यादा बाइट हुआ है वहां पे हमको इम्यूनोग्लोबुलिन्स प्लस वैक्सीन दोनों चीजें देनी होती है।
Right, I think these are the questions. If any other participant who are watching us live can drop their questions in the drop column, with just below the screen there is a column, a drop box where you can place your questions. We'll just wait for some, at least 1 minute so that at least we can get some more questions, and if not, then we can close this webinar.
Okay. रेबीज के बारे में पहले जो लोग कहते थे कि रेबीज को हाइड्रोफोबिया भी बोलते हैं.
Yes.
हाइड्रोफोबिया इसका हिस्टोरिकली इसको बहुत ज्यादा नाम फियर ऑफ वाटर, हाइड्रोफोबिया करके इसको प्रेजेंट किया जाता है.
Yes, sir.
ये इसलिए होता है बिकॉज ऑफ द सिम्पटम ऑफ पैनिक एपिसोड्स when presented with liquids to drink. Because when infected people drink water, there are spasm of pharynx.
Yes, sir.
तो choking होने के chances बहुत बढ़ जाते थे. That's why it was referred to as hydrophobia, fear of water.
Yes.
And the earliest symptom that we feel in the patient of rabies, that we see in the patients of rabies, is fever and tingling at the site of exposure. And this symptom can appear instantly, after few days or after years.
Yes.
And other symptoms, these are the general symptoms: nausea, vomiting, and violent movements. Yes. Okay.
Sir, there is one question from Dr. A.K. Tiwari. He is asking about the compliance rate related to 5-dose and 3-dose. So there is one question. So
compliance rate related to 5 and 3 doses. Compliance rate, exact study about the compliance rate.
Please tell me how beneficial is 3-dose over 5-dose?
Beneficial, definitely beneficial है. Because 3 doses के बाद में patients हो सकता है कि भाई जब उसको 4th dose लगना हो या 5th dose लगना हो, उस टाइम वो वहाँ पे available ना हो पाए.
जी सर.
तो यूजुअली ऐसा होता है कि भाई 3 डोजेस तो आदमी ने हफ्ते भर के अंदर, अगर विद इन वीक आपको कुछ लगवाना है, आप एट ए टाइम प्रेजेंट हो, तो ठीक है भाई, आप लगवा सकते हो. लेकिन इसके बाद आप 21 डेज 28 डेज पे आप कहाँ पे चले गए हो, तो इससे कहीं ना कहीं तो कॉम्प्लायंस डिस्टर्ब होता ही होता है. ऐसा नहीं कि 1 महीना में जो आपको काम करना है और हफ्ते भर का काम करना, अगर यही रिड्यूस होके सिर्फ सिंगल डोज हो जाए तो कॉम्प्लायंस और अच्छा हो जाएगा. 3 डोजेस है ना, अगर सिंगल डोज हो जाए तो बहुत अच्छा है, कोई भी नहीं मिस होगा, सिंगल आराम से लग जानी है.
Absolutely, absolutely. Thank you, Dr. Mohit. Actually, really, sir, we all have enjoyed the way you have presented, the way you have shared your in-clinic experience, and the way you have answered the questions. So, sir, Mohit, sir, thank you so much. And one more point I want to raise is that all the participants who have joined. Sir, now the number is around 75. So I like to thank everyone for joining us live today. This is an initiative Kerala Pharmaceutical has taken to eradicate rabies from India. As the government of India says that by 2030 there will not be any cases of rabies. So we are in that mission, and definitely with the help of the team doctor like you, definitely we will eradicate rabies from India, sir. So Mohit sir, once again, thank you so much, and all the participants, thank you so much for joining us. And please do consider and pass on the benefits of rabies, the 3-dose novel anti-rabies vaccine, to your next animal bite victim. Thank you so much, everyone, for joining us.
And thank you all the participants for joining us. Thank you.
Thank you. Thank you, sir.
Thank you so much. Thank you so much, Mohit sir.
Thank you, Megendra and team. Good job done. Thank you so much.
Thank you, sir. Thank you.
Thank you.
We can log out now.
Yeah, we can.